Hello everybody. Today we're going to talk about the treatment of tension headache in physical therapy. Key points. The headache can be caused for different situations. Can be related with cervicogenic headaches, or it can be related just for migraine, or it can be related for dehydration. That's another cause, or it can be also systemic, a blood pressure, a high blood pressure, and others. So when we have somebody that come to your clinic with headaches, we have to screen and find out what could be the possible cause of that headache. Is this related with musculoskeletal injury, or is related for a systemic reason, as I mentioned before. So when somebody comes with a cervicogenic a headache, it's coming from the tension in the cervical area that we can determine what palpation of those muscles in those areas and asking the patient if they have pain or they have tend to have the pain radiating to the side of the head or the posterior portion of the head. So we also recommend the patient to use a cold pack to decrease the vasodilation of those all the blood vessels, and that help also with the headaches. So is the cervicogenic headache also can be caused for trauma. It can be for fall, impact to the head. It can be residual for a concussion. Also can be for whiplash for a car accident. Also whiplash can happen from a fall. That can be from the back where suddenly your neck move forward and backwards. And other time those headaches don't show immediately. They come after a while. And then with the screening appropriate outcome measure, we can determine that this is coming from there or not. And sometimes those headaches come together with other symptoms that we can see that the patient refer tingling or numbness in the upper extremity, or they can say, oh, every time that I do certain motion, I have that pain. So right here, so we put pressure points in the different areas. After the assessment, we do certain pressure points in the cervical paraspinal muscles at both sides, and we always ask the patient is they feel comfortable with the pressure. You feel comfortable with the pressure?
Mm-hmm.
We also have to be sure that the pressure is not exactly on top of the vertebral arteries, because we don't want her to pass out or feel that she's feeling dizzy. So this is a very sensitive area here. So we have to be sure that we're on top of the muscle and not in the blood vessels. We also can combine a pressure in the different areas of the skull, mastoid process. We're trying to get the occipital area, like a trigger point, release the pressure, massage in this area, temporal parietal area. And then if the patient has too much headache, I tend to combine it with ice therapy at the same time to relax those muscles. We should expect that with one treatment, the patient should report at least some muscle release, decrease in the tension, and also decrease in the pressure of the headache with one session. Of course, that will take more than one session in order to help relieve the headaches. At the same time, we're going to give instructions for the patient to follow at home in order to help with that as a treatment. Thank you.